Well, it's Friday, and we got through another very difficult week. Lots to reflect upon. I'd say this week was sort of the good news and bad news week. Let's start off with the numbers. There's some bad things going on with the numbers. The first is that it looks like we're clearly in a second wave. The numbers continue to increase. Our rolling 7-day average is now about 400 cases. When you think about where we were at peak last time, it was 415. So we're almost back to where we were, and so clearly we're in a second wave. The other interesting thing is our testing percentage is higher. So we started off pretty high at about 8%, and then as we tested more and more new folks that were probably not symptomatic, it dropped down into 3%, and now it's right back up to about 8%. And one of the reasons we're filming here is this is Dr. Piedra's lab, and this lab has been one of the first labs to really expand our testing, our PCR testing, and is also the lab that developed a really good antibody test so we can do the prevalence study that we all want. Now, one of the good news piece of it is that despite this increased number of cases, our ICU volume is mysteriously plateaued. I have no idea why it has. If you recall, last week I said it was gone up from 10 to 12 to 14 to 16%. Well, after the past several days, it's been right at about 15%. Not exactly sure why. Don't know if the people are getting less sick or we're going to see a bigger wave later, but it's just an interesting phenomenon. The other thing that's very interesting is if you look at our case fatality rate in Harris County, it is about half what it was in New York. So we run between 3 to 5% fatality. In New York, it was closer to 10%. So there's some differences, regional differences. There's some differences about the number of ICU admissions. So we don't really know exactly why. But I do want to say that if you look at it from the perspective of where we were and where we are, there's actually a lot of good news. And Dr. McDevitt, our Senior Vice President for Clinical Affairs, summed it up in an email that he sent out to all of Baylor this past week. But I think it's really important to emphasize our health system was stressed, but we didn't fail. And we still have capacity. And unlike Lombardy, Italy, and New York, where they exceeded their capacity, we did not, and we still have not. Of course, we're not out of the woods, but we haven't. If you'll recall back then, we were desperately in need of PPE. We were very concerned we would run out. One of the reasons why we closed all elective procedures was because we wanted to preserve PPE. Well, now we have plenty of PPE. It's not that we are surely out of the woods, but we have enough PPE to go around. One of the other very positive things is we have never really experienced serious intra-hospital spread. If you look at Wuhan, many of the physicians and healthcare workers died from infection with COVID-19. In New York, there were several deaths because of COVID-19. We haven't even had transmission, so we've been doing surveillance testing. We tested 800 of our frontline workers, people in the ICUs, emergency room physicians, anesthesiologists. And in those 800 physicians and healthcare workers, we've had only 3 positive. And when we sequenced the virus, that virus came from the community. It didn't come from patient transmission. And so we think that because of our practices, in some strange way, it's safe to be in the hospital. It's almost safer than being out in the community. And there's one other piece of data that supports that. New York State has a study that looked at antibodies to COVID-19 and compared healthcare professionals versus the rest of the community. And amazingly enough, healthcare professionals had a lower prevalence of disease than the community, which means that those practices that we take care of in a hospital, putting on masks, being careful about shielding our eyes, washing hands, actually are incredibly effective at preventing the spread. The other thing is we actually know a lot more about treatment. If you recall, people were throwing out all kinds of ridiculous concepts around treatment, anecdotal examples of what would work and what wouldn't work. But we now know that remdesivir does work, and that is available for our patients. We know that convalescent serum seems to work. And we have clinical trials going on the IL-6 inhibitor. So we now have treatment options, and there are several others in the making, and a lot of vaccine trials are underway. We're also beginning to understand more about the virus itself. We know that it gets in through the ACE2 receptor. We've now seen a lot more renal disease. We now know that there are microvascular complications, and there's this Kawasaki syndrome that is seen in children. So we're beginning to understand the virus a lot more. The other thing that's really important is we did plan for a surge that would overrun our hospitals. And we planned out what we would do and how we would deal with that and how we would staff it. And even though we didn't use it, thank goodness, we're prepared for it. So we actually have been prepared for if we do come into serious need for expansion. And the other thing early on is we had no ability to do testing, and because of the Tony's lab and our Genome Center's lab, we now can do well over 2,500 tests a day for the RNA PCR, and we'll soon be upwards of around 5,000 to 6,000. So we have really expanded that testing, and Tony Piedro's got a really great antibody to do a prevalence study, which we'd like to do now for the county and the city. So compared to where we were and compared to where we are, I think we're actually in great shape, even though our numbers are not looking fabulous. And really, that's related to opening of businesses. People have thought it was Memorial Day potentially, but actually it's been a steady rise. And to me, that speaks more of the opening of business more than a peak one-day event. I'd also like to think about what happened this past week with George Floyd's funeral. As I mentioned last week, it has been very tough on all of us, and the African American community in particular, to what's going on. And what I did was take my own advice last week. If you'll recall, I said to people, you should deliberate, think about what's going on, have conversations. So I took the opportunity to actually have a lot of conversations with my colleagues, both black and white colleagues, about what's going on in our country. Mostly what I did was listen, and I think I've learned a lot in the last week. One of the things we talked about, and I heard a lot about, was the reasons for institutional racism, that if you go back to the 30s with how federally sponsored loan programs excluded certain neighborhoods, particularly black neighborhoods. If you look at the early introduction of Social Security that excluded vast swaths of the working community that really was overly represented by black citizens. These were things that started and took 3 or 4 decades to correct, not to mention the centuries of racism. And so when you think about it, institutional racism is a real problem that we have to address. And then the other thing that I learned, and I really feel bad that wasn't aware of this, is I talked to a lot of our black faculty who talked about how difficult it is to be a minority professional in a predominantly white profession. And the extra pressures, the pressures to excel, that you can't just be average, you have to be way better than everybody else. The pressure to excel, that is something that I think I had never really considered or thought about. And then on the alternative side, being a minority in their own community, because there are not many professional physicians that are in that community, and the pressures that they feel also in that community. And I have to admit that I was not sensitive enough to those issues. And I think it's happened, what I'm beginning to understand maybe for the first time, is that just not being a racist is probably not good enough. We have got to be anti-racist, and we're going to have to expunge this disease from our society if we're going to achieve what we want to achieve. The last thing is I'd like to reflect a little bit on George Floyd's funeral. For one, we had huge numbers of people that turned out to silently protest his death. And the main thing about that, both here and downtown, this is all different races and colors. So this is something that brought everyone together. The other thing that I was very proud of our city was that it was nonviolent and very well controlled. And so I thought that spoke much much more strongly for the issue of racism in this country. And then what was great about the funeral itself, it really was not protesting his death, it was really a celebration of his life. And I think the single most inspiring thing for me this week was this response of George Floyd's family. Now, if any family had a reason to be angry and resentful, but that was not their response. The response was tolerance, acceptance, trying to be a better community. They implored all of us to do better for our own communities and to make sure this kind of stuff doesn't happen anymore. So I was inspired by their message more than anything this week. And you have to really commend them and use them as examples going forward. And so I commit to, for me personally, in our institution, we are going to do better. We've got to create a better environment for our minority faculty, no matter what minority they are. The Chinese faculty have been under a lot of pressure because of the president's proclamation. We need to consider them too. We need to consider everybody. That's what George Floyd's family said. Think about all people who are feeling oppressed. And I think we deserve that. We deserve to do that for them. The last thing is, sometimes you think it's too big a problem in society for us to actually do anything about. But when you think about it, we have a tremendous community reach. We have been in this community for 70 plus years, and we have been a big part of it. And we've done very good things. We did the DeBakey High School, Rusk and Ryan Academies. We can do more. And I want all of us to figure out ways we can be more effective in doing what Floyd's family wanted us to do. When George Floyd's family implored us to be better, I think we should try individually and as an institution. So once again, I'm so proud to be part of this community. Baylor College of Medicine does so much and is so much a part of the community. We can be better as an organization. We can be better individually. And I ask you all to try and do so for our sake, but also for the sake and memory of all of the injustices that have happened in the recent past. So thank you again. Have a wonderful weekend. Thank you, Baylor College of Medicine. Thank you.
Yes, of course, we are here to honor George Floyd and his memory and everything that he stood for. But we are here for so many more reasons than just that. We are here because we are charged to take care of our community, our city, our country,